Hi guys, welcome back to the channel. Last class we have started the treatment part of osteosarcoma. We have seen that they are ideally treated with chemotherapy, then which is followed by surgery, and then again additional induction of doses of chemotherapy. We have seen that the chemotherapy protocol: first to sterilize the micrometastatic deposit, second to assess the tumor shrinkage, and third was to decrease the tumor bulk. And we have also seen that the neck dissection is not required in case of osteosarcoma. Okay, let's start today's class. So after post chemotherapy, doxorubicin is usually used with every protocol. हम कोई सा भी प्रोटोकॉल यूज़ करें तो पोस्ट कीमोथेरेपी विल यूज़ डॉक्सोरूबिसिन. नाउ विनक्रिस्टिन, cyclophosphamide and prednisone are commonly used as well. Mifamotide is often added in post-surgical phase to sterilize residual malignant cells in the wound. So these are the chemotherapeutic drugs, or post chemotherapy these drugs are used: doxorubicin, vincristin, cyclophosphamide and prednisone, or mifamotide. Mifamotide is mainly used or added in post surgical phase to sterilize the residual malignant cells in the wound. Okay, now the initial 5 chemotherapy inductions are physiologically and psychologically stressful. जो हमारा इनिशियली कीमोथेरेपी इंडक्शन जो देते हैं या जो कीमोथेरेपी स्टार्ट करते हैं, दे आर फिजियोलॉजिकली एंड साइकोलॉजिकली स्ट्रेसफुल. मैरो सप्रेशन विल प्रोड्यूस एन अनेमिया, थ्रोम्बोसाइटोपिनिया एंड ल्यूकोपिनिया. तो इनिशियल स्टेज जब इनिशियल कीमोथेरेपी चलेगा तो ये सब भी होगा: अनेमिया, थ्रोम्बोसाइटोपिनिया एंड ल्यूकोपिनिया. नाउ a 1-month period between such chemotherapy and surgery will allow marrow recovery as well as psychological recovery. तो जो वापस जो हम लोग देते हैं आफ्टर सर्जरी वाला जो चीज़ रहता है या बिफोर सर्जरी वाला, तो 1 month पीरियड देना चाहिए हम लोग को बिटवीन कीमोथेरेपी एंड सर्जरी. That will allow marrow recovery and as well as psychological recovery. Along with that, vitamin C 250 gram 3 times daily is given during this 1 month period of recovery, and iron, that is ferrous sulfate 225 mg 3 times. Okay, anemia को treat करने के लिए. If the osteosarcoma is in mandible, the resected area is initially best reconstructed with a rigid titanium plate. Microcutaneous or free vascular soft tissue flaps may be needed. We should always remember that soft tissue flaps are used, okay, during mandible reconstruction along with rigid titanium plate. Okay, after 6 weeks, plate and flaps are healed, so post-operative chemotherapy can be begin. Reconstruction of the bony defect leading to dental rehabilitation after recovery from post of chemo phase. जब post of chemo हो जाएगा तो we'll do rehabilitation. If osteosarcoma is in maxilla, hemimaxillectomy, a variation of it can be used. As oroantral communication is certain, oronasal antral communication is certain, provisional obturator prosthesis at the time of surgery. This obturator will reduce hypernasal speech and nasal regurgitation of fluids and food in the early post-operative phase. Later, it is replaced by definitive denture obturator prosthesis. It takes about 6 to 9 months for the defect to be stable. सो जब हम लोग मैक्सिला में कर रहे हैं हेमी मैक्सिलेक्टोमी या उसका कोई वेरिएशन कर रहे हैं, तो वी शुड ऑलवेज कीप इन माइंड कि ओरोनेजल कम्युनिकेशन हो रहा है. तो ड्यूरिंग सर्जरी ऑल्सो वी शुड प्रोवाइड अ प्रोविजनल ऑब्चुरेटर, एंड आफ्टर सर्जरी इन अर्ली पोस्ट ऑपरेटिव स्टेज वी शुड गो फॉर डेफिनेटिव डेंचर ऑब्चुरेटर. ओके, Now, coming to prognosis, 50% 5-year survival rate, therapeutic failure result from local recurrence followed by lung metastasis, brain and other bone. Prognosis worsen with a delay in diagnosis and treatment. Histologically, no grading system is there. Presence of tumor emboli in the venules within the specimen is an ominous sign. So we should always look for this. Presence of myxomatous cells, tumor cells, necrosis will result in poor prognosis. Osteosarcoma that produce abundant calcified bone are often associated with poorest prognosis. Follow up a clinical oral and head and neck examination and a chest radiograph after are recommended every 4 months for first 2 years and then every 6 months for the next 3 years and then on annual basis. ऐसे follow up करना है. That's all about osteosarcoma. We'll be starting next topics in the next class. Till then, like, share, subscribe and comment. Bye.